everybody.
Yeah. Okay, I would like to call to order the Public Health and Community Service Committee meeting on June 29th, 2023 at 8:35. Kathy, can I get a roll call, please?
Hendricks. Ness.
Yes.
Shorten.
Here.
Van Hoff. Wagner.
Here.
Altoff. Von Bergen.
Here. Next, can I get a motion to approve the minutes for June 1st? Blake Shorten, second. Are there any amendments or revisions? Okay, seeing none, all those in favor?
Aye.
Opposed, motion carries. Public comment, none. No public comments. Wonderful. Last call for member comment, or public comments. How about any member comments? All right, Ms. Ness, do you want to start us off
With member comments?
with member comments?
I would like an espresso. That's all I
Duly
have.
noted.
I have no members.
She's even taking notes on that one.
Yep. Yeah, espresso. I just had Hetty Cup out for
Okay.
coffee, so we got a coffee supply. Okay, moving right along.
Let's get it over here.
Good morning.
Let's get it over here if you want.
Come join us.
You could still see it, Gloria. Okay, no.
Okay, cool. Yeah, we have another.
Okay, so new business. We have several interviews this morning. Do we have Matthew Kostecki here?
Yeah, she's steady.
It's nice to see several interviews. Okay.
He's not here?
Let's see. Christina is Hernandez is WebEx. We don't see her on. I don't see Sarah or Guadalupe. So how about we come back to that? Let's see here. So routine consent agenda. Is there anyone who'd like any items removed for discussion?
I was gonna say 6-1, but Hans is not here, so.
What?
Yeah, I was gonna say 6-1, but doesn't Hans need to
Get him
be?
down here.
I just wanted,
He's probably looking at this and thinking he has.
probably.
Plenty of time, yeah. Pretty soon we're gonna get to adjournment here.
Just keep going at that
Right? Go back to beverages.
There you go.
Yeah.
Let's go back to the espresso.
But we have to say it right.
Yes, that's true.
It's not espresso.
Oh.
S. Well,
I don't know.
Lou, would you like to talk about workforce housing?
Sure.
Give us an update on that.
We had a great meeting. Jake and Jeff are here, and I can tell you we have the perfect people at the table. The discussion was healthy and vigorous and lots of questions. And then we did a whole whiteboard, all the stuff we want to investigate and explore and who we
Look
want
how
to bring.
excited he gets. The whiteboard.
We actually have 2 whiteboards.
Oh my goodness.
Yeah. Even in hard heaven.
You probably have a whiteboard in every room, right? With a strategic plan heading.
That's heaven.
And then Pam and I and Scott were charged with taking all of that and putting it into an efficient and effective outline in how we're going to move it forward. And we did that on Monday, and that was great. We did come up with a definition that we're going to present. Do you want to tell them what it is?
I was in a position to, when I get my.
60 to 120%.
Of the median household income.
Yeah, so we left it
Yeah.
income-based. So if you earn $400,000, you still should only be paying 30% of your income for housing expenses. And is there a place available for you? We eliminated the words low-income earners. We looked at what makes a community work, from public works people and garbage men to retail people to city managers. And so we've come up with a very broad definition of workforce housing, which then the group will approve. But yeah, I think we're doing well, don't you? I mean, Jeff and.
It was a good discussion, very good discussion.
Yeah, it was a lot of disagreement at the table, which was wonderful. It was great. So yeah, our next meeting, we're bringing in.
We're going to have the developer who's doing the project in McHenry that received the assistance from the county's ARPA program, to speak in how they approach workforce housing, some of the tools that they use, some of the challenges that they have, really to help educate the group. And we're going to try to line up another developer that works within that area, not the area, but within workforce housing, just so we can understand from the developer's perspective what they're facing and what their challenges are and what their opportunities are as well.
Yeah.
In the discussion, I just want to highlight, we really boiled it down to 3 distinct categories. You have the data. That's one thing we're going to look at. Jake has been hard at work pulling a lot of data, employment data, salary data based on different fields. We're able to break it down, or try to break it down to communities or zip codes within the county. The second part is the narrative. This is so once we have the data, we understand the data, then we're going to have the narrative of the high level we're looking to accomplish. Then the third step will be the roadmap, and this is really the education to our elected officials or to members of the public,
City council people.
of the importance of workforce housing. And it's not just one-dimensional, it is multidimensional. It involves transportation, it involves the economy, it involves quality of life. So all those components, just to help people understand why it's so important to a vibrant and successful county and community.
Yeah.
I have a question. Is it okay to ask questions now?
Yeah.
It used to be, when we were talking about affordable housing, it was 33 or 34%?
30% of income.
Okay. I remember it was 33%.
Yeah.
So I'm not trying to split hairs or anything. I just wondered if that percentage changed.
That's housing expenses as opposed to the average median income. Maybe you can answer.
So 30%, and I can pull off the source, and that's a national standard that's being used and that was presented. You have to keep in mind that when you look at housing, and the rule of thumb has always been it should be a third of your salary.
Okay.
But there's
A
also
third, it would be 33%.
there's a lot of other costs that go into it, and I think that's why it's down to about 30%. So there's a lot of other.
But can you explain the 60 to 120?
So the
Anybody from that committee who can explain.
So the median income of not just the Illinois or national median income, but looking at the county's median income, and I think that was 80,000.
For the county, it came out, so if you look at all of the positions, right, average-wise was $25 an hour with everyone, which comes out, if you do that full-time, you're looking a little bit over $50, $52,000 for just, that would be a single person, so that's not necessarily household. We were talking a lot on household as well, individuals living together, obviously that's going to be higher, but position-wise, and I think the big thing is we were trying to focus on career-based, what kind of positions are really targeting what we're looking at. So these are like our nurses or healthcare individuals. In the pay range we're talking, that's very much where a lot of them lie. So how can we help support them with their housing needs as well?
Because we have to start somewhere.
I understand
Yeah.
that.
Yeah.
You know, I'm a jack of all trades. I had a real estate license long
Yeah,
ago, and
well,
I just
and-
remember it being 33%. And I just wondered if that had changed.
No.
Had dropped to 30.
No.
Okay.
And then people who fall very, very low on the income, on the other end of the income range, sometimes qualify for housing services or COC services, which people at, 60 to 120 don't.
Exactly. I can throw something else into kind of what you were saying before. So they have the front and the back end that they use for mortgages. And so you commonly will see that 33% involved there. And then that back end is, of course, adding all your other bills too, right? So then that's in the 40s somewhere is a good range for people. Our median income for a family of 4 right now, 100% of it would be $110,000. So 50% EMI, which is I have in the chart online right now, is $55,150 for a family of 4. So that's roughly that $25 an hour range.
Yeah, and then people have to go out and find stock. So we're also looking at stock. What do we have in this county currently? And Jim Heisler from the Realtor Association, they're going to start to put some of those numbers together. And what we'll have ultimately is a spreadsheet. We're looking at specifically cities across the metro line, because we're enrolling transportation into that formula when we talk about livable livable, workable communities. So you'll get this. Our goal is that you will get this sheet that will tell you. You'll be able to say, Carrie, well, they have no stock, but they have this many income earners who live outside the community because they can't afford. So that's our goal in the year, to have something like that for people. And we want to educate county board members along the way so that at the end of the year, we're not dumping you in the workforce pool and expecting you to start from scratch. Did I miss anything, anybody?
It's just on a high level, the task was handed out as very nebulous. And now we're starting to just get some definition and clarity to it. And next meeting, I think we're gonna have a much better understanding, and we're gonna get much more clear on what we have, what we know, what we need to know, and then from there, we're gonna put together, I think it's gonna be a really, it's gonna be a very useful and insightful document of our workforce in the county and their availability of housing stock, and then some of the challenges and some of the needs. So excited about that.
The other thing is we are connecting with Kane County and DuPage County to put a regional conversation together so that we can see what are they doing, what have they pulled together, what is useful.
They have similar initiatives. Well, I can say similar. The topic of workforce housing is
Everywhere.
For both of those counties as well. So we're just get together and see what they're doing, how they're doing it, and let them know what we're doing, and maybe.
Yeah, we can try to avoid redundancy.
Mhm.
So that's it.
Wonderful. Well, thanks, guys. Let's move back to the routine consents agenda. Are there any items?
6-1.
6-1?
6-4.
6-4. Any others? Okay, so can I get a motion?
I so move.
6-2-3. All right, thank you, Ms. Ness. Ms. Wagner? All right, could I get a roll call, please?
Ness,
Yes.
Shorten,
Yes.
Van Hoff,
Yes.
Wagner,
Yes.
Von Bergen.
Yes.
Heinrich.
And I would like to be recognized at this point as
Oh,
well.
I'm sorry, I stepped out to call an applicant.
Yes.
We're not going to recognize you. You're unrecognizable.
It's the mustache.
It's the mustache.
Yeah.
Speaking
Okay.
of public health.
Can I get a motion for 6-1? Ms. Wagner, second by Mr. Shorten. And discussion.
Thank you very much.
So,
Let's see, that would be Mr.
Good morning, everyone. For the
Good morning.
record,
Hans Mott, Community Development Administrator. I'm not interviewing for the Board of Health.
Are you sure?
I'll take a point loss on that one. But anyway, but I digress. Anyhow, I'm here to talk today about the 2023 Annual Action Plan for Community Development. Something that just got brought up was discussing some other communities, and so we all create, we have an entitlement of CDBG and home funds. We all complete what's called a consolidated plan. So I can actually tell you what they're doing to address their housing initiatives regionally. I can just get those plans and plug something out for the workforce group, so I think that would be helpful. Each year we create an annual action plan based on the projects we intend to support. The county board pre-approves all of our projects. So everything that's in our annual action plan has already been approved by the county board. In some instances, other communities may have like a director somewhere that makes the funding decisions, or maybe a local council or something like a mayor. Ours is all pre-approved by the legislative bodies, so we go through not only this committee, our CDHG commission, and the county board. So what's in our plan identifies what we intend to do for 23. The 23 plan year begins on 10/1 of this year, ends on 9/30 of next year. Some of the commentary that we've gotten so far has been exactly what we were talking about a little earlier, narrowing down the focus of our projects, reducing maybe the number of projects, and increasing the focus on housing. That's just, it's coming across the board for the homeless system and just affordability in general. So that's the gist of it. It's, you know, I think there's any opposition to what our plan states because it's already approved by the board. So.
Okay.
Well, it's not already approved. Excuse me, the fund is already approved. That's why I'm here.
So, my question, first, so the amounts that are allocated to each, is that something that went through the CDBG committee?
Correct, and then it goes to PHCS and then to county.
Okay, that's what I thought. All right. And there was a public hearing yesterday, right?
There was a public hearing on Tuesday, and we had no individuals that showed up. We did have some discussion yesterday regarding the COC strategic plan, so there was some commentary at that meeting, and it really was more focused in on what are you going to do for the next one, which is the 24 plan. At this point, Congress, as you know, has not voted on a budget for October 1st of this year. So we're like a year behind, by the way. When our funding comes in, we extended our year intentionally to be a year ahead of things, so we would know what the funding is a year in advance. It gives us a lot of time for planning and everything. So that gives us plenty of time to consider what we want to fund for next time. But the only caveat of that is not knowing how much funding you're getting because Congress isn't in budget. So that takes a while, even after the budget's approved, for us to know even what our allocation is. But what we can do is something provisional and say, all right, here's sort of a framework for it. And then when applications start to come in, it will be based on that framework. So that's what we intend to do, this go around and see how that works out.
Okay, and I just have one other question. On page 12, it says here that our vacancy rate is 3% or lower. So what is this, just, I want to compare that to the state of Illinois for rental vacancies.
Yeah, their rates the last time I reviewed that is probably more like 5. You know, so our rates are so low in some communities they're even lower than that. Like it's just things are snapped up pretty quickly. I think you've heard in the past, one of our board members, I think it was Mr. Guadalupe, had stated that at the time we did the study for IDA, there were no units period in McHenry, and that's why you're seeing a big focus on projects up in that area.
I think that's the other reason the Housing Authority has closed their Section 8 list. They had like 20 vouchers and they had close to 400 people apply. And they're not even keeping a wait list anymore because there's just no, people don't leave, so.
No way to get through it, you know,
Right.
in the short term.
Right.
So our vacancy rate at the time that this was done was roughly 3%. Now it's roughly 5%.
This-
What is
this-
it on any
this
in any
is-
given year?
You know, so in the past, we've seen higher rates, like 7%.
So okay.
So like I'm going back to like 2016, when I started working here, we were seeing things kind of more in that range. It was a little bit easier to find a unit. So what we were lacking at that time was the funds for rental assistance, everything. Now we have the funds, but not the units to rent. So we run into that opposite problem. So One example too is we were just notified that the state has allocated money to the COC, about $860,000 for three different programs, but 2 of them are focused on rentals. Now we have to have units for those, so we need to find landlords like quick.
So we surveyed a few landlords as, you know, on the workforce. And to a landlord, if they have a vacancy, they get no less than 150 applications immediately for that unit. I was just like, wow. And so the cost of the rental, I mean, I'm not criticizing the landlord, right? Make hay while the sun shines. A studio is 1,100, is about the lowest.
And that's just gonna be snapped up too, but
Yeah.
it's just, there's nothing there.
Yeah, so Eric, to your question, stock, available stock is a very important component of housing.
Oh, yeah, supply and demand.
Yeah, well, it's not even demand, it's there's no, the building that's being built are single-family homes or condos, right? But they're high-end, and so, so anyway, yeah.
So it's roughly 3 to 7% in a given year, typically.
That's kind of range over the past several years.
And do we know, like, if it increases or decreases by 1%, what that does to either the value of the home or the amount of rent that is anticipated to be
I mean, I
sought? If we don't know, that's fine. I'm just
yeah, I
wondering.
can tell you that we fluctuated with the number of owner-occupied units compared to the number of rental units. And so we had a point in time where it was much more of homeowner, and then with the downturn back in like around 2008, 2009, we went to more rentals, and now they're going back to single family. So even those homes that were rentals, some of those are being converted back. So what you see in here, it was discussed, is that, yeah, we had increased our number of units, but then it started to plateau in the past year and a half, 2 years. But it would be hard to statistically answer that. That might take a little bit of trigonometry or something.
Right.
It's been a while since I've taken that.
I have a question. Has Pioneer Center answered that question in their proposal for the high empty bed rate at the shelter?
They wasn't answered by Friday,
Okay.
tomorrow.
Great.
So that's a good reminder of that. We did.
I'd really like to know what they propose
And
in
the
terms
service,
of.
the service hours too, right? They were looking at that also?
The service hours, the number of beds, just the accessibility
Yeah.
overnight especially.
Is it possible to say we don't need that many emergency beds and to take a look at rehabbing some of that space for SROs?
I think SROs are great. I think if we could do that, that would be an excellent idea. I'm not certain of how zoning would work for something like that, or whether the owner that's a church there, that would they allow an SRO?
We own the building, right? Pioneer owns the building.
We don't. The chapel owns the building.
We gave money to a church.
It's sort of a split kind of thing, but we don't own that section of the building.
We gave it to Pioneer. We used it to purchase the building of the church.
But the church is the primary owner?
It's a sponsor agreement.
Well, that's another little piece of
It's
information.
tricky, very interesting.
Thank you for that.
Oh, you're welcome. It's all public information, so.
I just wanted to ask one more question regarding what Eric asked about the vacancy. And I think I heard you ask the question, but I didn't hear the answer. I was up late last night, so my brain's not working well.
It's all the smoke in the air we can't.
Yeah, that's it, I'm sure. So did you say that the vacancy rate is pretty uniform across the country?
Oh, no, sorry, the
It
vacancy
varies
rate.
quite a bit depending on, what about Lake King and like Boone County, say?
I could probably find that information. I can tell you, in the past, we've seen scenarios in which our housing authority, of course, isn't accepting anybody, but people have been able to go to like a place like Stevenson County, like in Freeport, and go ahead and go into their system now. I don't know if that's still the case, but that would appear to be, there are vacancies over there. However, what are the opportunities for somebody moving there is the problem. So I can probably find that information out, like as far as the regional.
Yeah, the neighboring counties, I would be really interested to see that.
Sure.
I know and again, we're gonna be looking at higher costs when we move into some of these other counties too.
Exactly, anywhere around the collar areas are pretty expensive, is what we see. So, but I'll find out the vacancy rates, and of course for our workforce housing group, I want to see what other communities are doing with their plans, so I can locate that information.
Great. Any more questions for Hans on the action plan? Okay, seeing none, can I get a roll call?
Alta. I'm sorry, Wagner.
Yes.
Van Hoff.
Yes.
Shorten.
Yes.
Ness. Yes. Von Bergen.
Yes.
Eric?
We forget Eric.
You continue to be
Yes, but-
invisible, my man.
That's all right.
You were invisible. I am not on my game this morning. I see you.
We do need that espresso machine.
Yeah, I didn't have my coffee. That's it.
Productivity. Okay, could I get a motion for 6.4? Mr. Shorten and Ms. Wagner. Good morning.
Morning.
Okay, discussion. 6.4.
I don't want to spend a lot of time on it because it's $5,000. We wanted to get an understanding of the money coming from the CDC, $5,000. And this is going towards refugee, immigrant, and migrant. Is it just informational?
Yeah, these initiatives are around educating this population on how to find resources and help them to assimilate into the community and find the resources they need for healthcare, employment if that's needed, financial support.
Okay. And this information is disseminated through healthcare providers?
No, it's through, we're working with partners in the community, and who serve those populations, as well as the health department.
Okay. That's all I have.
Okay, great. Then I get a roll call.
Mr. Hendricks.
Yes.
Wagner.
Yes.
Ness. Yes. Van Hoff.
Yes.
Shorten.
Yes.
Von Bergen.
Yes. Okay.
If I may provide you with an update on interviews.
Okay, yes.
Our first interview, I have left him a voicemail and a email asking if he's still considering joining us. I could send him a quick WebEx if that's the case, if he got his dates mixed up. The second interview, Christina Hernandez, she was a WebEx because she had a work meeting. She has emailed me that the work meeting is running late. I asked her if she knew what time she would be available to interview. She said 9:30. I said this meeting was moving kind of quickly, but we do have some discussions, and that I would confirm with her if that was acceptable from the committee.
Okay.
I would move to extend the time to 9:30. Or, no, we won't end before 9:30 at least.
Okay.
Sorry, I don't, no one has to second me, but if someone's willing to interview, I would like to hear from them.
So
How
the
about
other
the
two?
Well, we have
One is
Sarah.
here.
One is
Sarah's
here. Okay,
And
Sarah is here.
the
Wonderful.
9:10 has confirmed with me this morning already, so I know will be here.
Okay.
Okay.
Well,
So
Sarah,
shall I
if you
call her
would.
yes then? Christina Hernandez?
Sure, that's only
Okay.
25 minutes. We have 2 interviews.
And perhaps she'll be done earlier.
And we still have another discussion, so, yeah, I think that'll be.
I'll have her jump on as soon as she's available.
Wonderful. Hi, Sarah, thank you for joining us. If you'd like to tell us a little bit about yourself and your interest in the Board of Health position.
I'm a 31-year-old single mom. I grew up in McHenry County my whole life, other than a 3-year stint in Walworth County when my son was first born. I grown up farming with my dad out in Marengo. He actually is on the Board of Health currently, though we have we don't share the same opinions. I have a long work history in healthcare. I currently work as a nurse at Valley High, been there for about 2 years. Before that, I was a CNA for 12 years, an EMT basic, at different fire departments. I'm looking to be able to help more in the community and give more opinions and such.
Great. Anybody have any questions? Go ahead, Ms. Wagner.
Thank you for being here today.
Of course.
So we all know that we're trying to recover from a worldwide pandemic, and it took a major toll on our health department. So what would you do if this happens again, whether it's a pandemic or a big emergency, to support the McHenry County Health Department?
Probably look at all our resources and what we have. Look at all the plans that worked for the previous pandemic, what worked, what didn't work, kind of adjust what didn't work and go from there. Look at other departments and other counties and areas, see what succeeded from there, and see if we can take advice from them. And also work in like other avenues, because even though it was a lot of like respiratory health and financial, there was a lot of mental health issues and travel issues, supply issues that were also needed to be addressed during that pandemic, I felt.
True.
What do you, let's stick with maybe top 3. What do you think are the top 3 health concerns in the county currently?
Opioid use, financial for getting medications, and respiratory.
I'm sorry, was the
Respiratory. I know that COVID's still kind of dying down, but there have been a lot of lingering respiratory issues. A lot of colds, a lot of flus. We've been seeing more rhinovirus, and now we have Canada's smoke
Yeah, that's not helpful.
causing issues.
And as you look at those obvious respiratory issues, it's a broader answer, but let's go with access to medication. Thoughts on how that could be addressed, whether at a county level or a broader level?
I'm not really sure, to be honest. As a nurse, we use the insurances and Medicaid, Medicare, and generic brands for our medications. We look for co-pays and GoodRx.
Thank you.
What about the health department is important to our county? So why is the health department important to McHenry County? In your view?
In my view, they lay the baseline of kind of like rules to follow, and I want to say like example that we need to lead by.
Hi, Sarah. Thank you for being here today. In your experience as a nurse, how long have you been at Valley High?
2 years.
2 years. Okay, so you kind of came in near the end of, COVID was kind of dying down. And I know it did hit Valley High later than it did in a lot of places. Just from your experience working at Valley High, what are some things that would have helped your job be easier as a nurse?
More staff.
More staff. That was a problem everywhere. That was a problem everywhere, and I know we're still addressing that.
Yes, I know it's a very generic answer, but being able to
No,
assess.
that's it. That was the number one thing. And then anything else? I'm on the Valley High.
Okay.
Operating.
Um,
So we're out there from time to time, and I know the memory care unit is being built and that kind of thing. So, what about, you mentioned supplies earlier?
yeah, like PPE.
Okay,
Um,
and I know one of the things that we had heard at Valley High is that they had ordered a lot of supplies. They learned a lesson from, another infectious disease spread. So they were stocked up on that. So they were really well prepared there. What was the third thing you said?
Respiratory.
Oh, the respiratory. So are you still seeing a lot of that at Valley High? And what can we do about that?
We've been seeing more pneumonia cases at Valley High. And we've been trying to figure out what's going on. We're not sure if it's the weather or just they're aging. But it is kind of increasing, we've noticed.
It could be air quality. Thank you.
You're welcome.
Mr. Hendricks?
You said your dad currently sits on the Board of Health?
Yes.
And I think you referenced something about he sits on the Board of Health, but you don't necessarily agree with them on everything, or you have your own views,
Right.
perspectives. Is there anything in particular related to the Board of Health?
Not that I'm aware of. He doesn't really talk to me a whole lot about board issues, but I just wanted to be clear that if I wouldn't be like always siding with him if that was to be brought up.
You have your own voice.
Right.
We find that our children are like that, as much as we try.
It's a good thing.
The other three daughters I can attest. They don't agree with me, and they don't, sometimes just don't want to agree with me.
So the Board of Health is a policy board. If you could say there would be one policy that would be important to develop for countywide, what would it look like? Not specifically, but an idea of a policy that would be important. I know that's kind of a out of the box question, but the Board of Health is a policy board, and so if you don't know that, that's okay.
I mean, from like my nursing background, I would just say more hand hygiene, like
So
everywhere.
better hygiene, public hygiene, educating the public.
Like I know during COVID,
Right.
we did such a good job of like
Yes.
spraying down with shopping carts and everything, and we could go back to.
And that is
Kind
a
of doing
public
that.
health
That was a
policy,
good- it was
promoting and
great.
educating the public on really sound hand hygiene functions to
And as-
reduce infection. So yes, see, you do.
And as soon as COVID went away, all that hygiene went away, so.
Yeah. And that is a public health function. Thank you.
Welcome.
And this is somewhat related. You mentioned PPE as an issue. Does Valley High, is there an issue with acquiring PPE or?
Not at the moment.
Okay, but there was at some point.
During the pandemic,
Okay,
kind of everywhere.
because
Everyone had an issue getting
Yeah.
PPE, but Valley High was in a unique position because they had stockpiled tons of that. So they really did have an advantage when you look at other long-term care facilities.
Okay, because I was gonna say, this isn't necessarily germane to Ms. Clark's interview, but didn't we just try to acquire a building a few months ago to store all our PPE? Maybe that needs to be something.
Well, I think it's to store PPE and correct me if I'm wrong, Pete, but part of the issue with the PPE access that we have now is that
It's
we have to
expired.
wait for authorization from the federal government to dispose of it.
Oh, okay, all right. Of course.
We still renting space?
We have our stuff at the former Housing Authority building. We're actually making improvements to the archive building so to accommodate it, and then we can move it over. But we're sitting on a lot of expired PPE that we cannot get rid of, and that's a challenge.
So we're paying to store.
We're not paying.
We're not paying, so the Housing Authority is.
At the former Housing Authority building with the big for sale sign on it.
Yeah.
All the PPE?
The one that
the
you said you
expired
were-
PPE?
All of it. Some of the expired at DOT, they put in cold storage, but the bulk of it's at the Housing Authority building, and we appreciate the Housing Authority accommodating that. And once we get our archives developed, we'll move it over, but it's,
Okay.
So,
it's a lot.
Interesting.
does anyone remember, was it scabies? Was that what it was that they had, that they stocked up on all of this PPE? No one remembers. I remember, do you remember?
I don't think scabies drove that.
Yeah.
Scabies was
It was-
like 2016.
Right.
But there was
Yeah.
something that,
Let's give an interview to Sarah.
Yeah.
Let's get back to Sarah.
Yeah,
Yeah.
but they did have stockpile.
Do we have any other questions
Do
for
you have
Sarah?
questions for us?
Thank you for, yeah.
Not that I can think of.
Okay, great.
Okay, great.
Thank you.
Thank you for joining us this morning. We will be deliberating shortly. You're more than welcome to hang out and wait for that. Otherwise, we'll be in touch.
Okay, thank you.
Thank you.
Okay. Is Guadalupe, you have a question? Or, let's see, who else?
Who was the back 10?
Yeah, Guadalupe.
Kathy, everyone, I apologize if this is pointed out, for the Board of Health, we have 4 interviews for 2 spots. Right? There isn't any particular type of person we need. Sometimes we have to have a dentist, sometimes we're kind of open in that regard.
Thank you.
Because we just appointed a doctor.
A nurse.
Yeah.
A dentist.
A dentist, yeah.
Oh, that's right, yeah.
Good morning, Board.
Good morning.
Good morning. Good morning, Guadalupe. Thank you for joining us and your continued interest in the Board of Health. Would you be willing to introduce yourself and tell us a little bit about what you've been doing and your interest with that position?
Okay, sounds great. Hi everyone, thank you for being here this morning for my interview. My name is Guadalupe Ortiz, and I grew up in McHenry County. I wasn't born in McHenry County, but came when I was about 2. Grew up in Woodstock, and went to school and came back and went to school for business, but wanted to work with youth, and I wanted to come back to my county and started serving youth within our county with Pioneer Center. Worked there. That brought me into the non-for-profit world, even though I had studied corporate. I really wanted to give back and discover my passion for working with youth and underserved communities. And that brought me to the position that I'm in now. I am Executive Director to Youth and Family Center of McHenry County. We are a non-for-profit in the city of McHenry, but serves all of McHenry County. And I still work with youth. We have youth programming, but we also work with adults. And within my journey of non-for-profit, I discovered a lot of barriers and a lot of disparities that exist, not just in McHenry County, but in the world in general. And but also discovered the things that we could do to help those barriers and disparities. One of them being education. A lot of the times within our agency, people don't know of resources in McHenry County, and I think that's our biggest thing, and building relationships with individuals. And through that journey too, I've got to meet a lot of different people that come from all over and with very different experiences, and I realized that those barriers don't just exist for a certain type of people. They exist for a lot, and experiences happen and life happens, and that really discovered my passion in trying to help and trying to get to know people and meet people where they're at. And in that journey too, the Healthy Community Study was something that I was very passionate about, just getting to know more our county and getting to know more of those disparities and what I could do to help as a community leader. And in one of those presentations for the Healthy Community Study, I was approached that the Board of Health was looking for members, and I had wanted to serve in a board. I obviously work with my board of directors, and an area that I wanted to grow in is board development. And I'm like, well, I will sit in a not-for-profit board, but I always thought it was gonna be like a conflict. It was gonna be weird for me to be a board member with a lot of our agencies that we partner with. We partner with a lot of agencies, and so never found like a specific board exactly. But when I was introduced to the Board of Health and county, I was like, I think this is maybe, I realized I went to school for a public administration, and I realized the connections and how everything is really connected. And I said, well, I think county is where a lot of change could happen. And I thought this would be a way for me to be able to come into this sector and provide my insight, my perspective, and hopefully my experience, and continue to do the work that I do as a community leader. So, I don't know. Thank you.
Does anybody have any questions?
Start
Yes.
again. Thank you. So thank you for being here and your service for the past 6 months. You came in on the tail end of the pandemic, which we know is still happening, but it's not as bad as it was. So how would you, if this happens again in the world, or even a big emergency in McHenry County, how do you think that the Board of Health could better serve the health department?
I think I thought about that a lot. Like my first board meeting, I was like, I don't know how. I would ask the board members too, and Melissa was like, how'd you guys handle the pandemic? That sounds like it was probably a really stressful time to make decisions and whatnot, and for the whole county. But I think I thought about how I would respond, and I think not losing perspective of like, I think we view that experience or any experience in like our world, right? And I think when you serve on a board, you're not just representing, your perspective, but the perspective of everybody else. And so I would try and get different perspectives and bring that to the board and saying, this is what in this area or in this expertise they're saying, or in this income range is they're saying, and this is what people are experiencing in our county. That is one. Trying to, again, through the relationship with people, I think going out with people and being like, hey, what could we do? I sit on the Board of Health. How is this? How is that? How are you taking this experience? How are you affected by this? One. I think another one would be that I've learned through my 6 months is I was really excited. I knew I was going to be excited to make decisions to help constituents, but I didn't think I was going to be as excited to help staff, which sounds crazy, but I do staff all the time, like as executive director, but it's fun to do it without when you're not like in charge of the budget necessarily as the executive director, and so and the board perspective. So I think bringing in my experience as being an employee and having to direct the board in that, like being in a position as a board member, talking to our staff and hearing where they're at, because I think it's important, the quality of service that we provide to our counties through our workforce. And I think the pandemic we suffered a lot, and we will continue to do that. And so how are our employees, I think, is also very, very important. So talking to different areas of McHenry County and seeing, their experience, but checking in on our staff and see how they're handling everything, and if they're okay to go and with the decisions that we're making and what we're asking them as board members for them to do. Thank you.
Laura, did you have a question?
I did.
Okay.
I did.
Did she answer it, maybe?
Yeah, yes, some of it. I guess, I'm concerned about a couple of things. One thing, I know you're busy with the job that you have. It is a monthly meeting, usually about 2 hours. So are you able to fit that into your schedule? Because showing up at the meetings are so important, and you know, that's something that I want to know about everyone who's applying.
Of course. Yeah, I think that was one of my concerns too in the beginning. I think that's why when I first interviewed, they asked me what term, and I picked the shorter term because I've tried my best to that it's okay to say no sometimes, right? And even though it's something that you really enjoy, and so I was like, and I know the responsibility that it is, and so I was scared. I'm like, okay, you know, it's something that I want to do. It's a big step, but let me know, let me see, let me test it out with a shorter term to see if it's something that I could. And I managed just great. I think it's actually like it's my away, like my me time. It sounds crazy, but my me time away from my agency because I'm not representing. It's hard to take that hat off in anything. But like when you're on a board, you have to take that hat off. I'm not representing Youth and Family Center, right? And so it was like my me time to take my executive director hat off. And so I didn't see it as like, oh, I have to go to another Board of Health meeting. It was like, okay, I get to be Lupe, like McHenry County resident Lupe. And so, you know, I didn't think it was like a heavy load the 6 months that I did. I was always rushing to the meetings, that I will say, but they're, you know, everybody was really good with sending us the information before, and so I wasn't prepping for, I realized that I couldn't prep for the meeting right before because I'm rushing from the office, but yeah, the time that it wasn't too heavy, I've managed, and I think that's my area of expert, or like my strong suit, that I can juggle a lot, and I've juggled a lot more, and so I think it was great. I didn't feel it was too heavy on me. So.
And then at the beginning, you mentioned something about just the disparities that exist in the community. Now, I know this goes to your other job, but can you just talk a little bit about that and how what you see that could be different as far as, you know, communication, addressing certain things, where these disparities exist and what we can do about that.
Okay. I can tell you one specifically that I think brought me to the Board of Health when they were presenting the Healthy Community Study. A lot of the data that was showing that I have a really loud mouth, and so I was raising my hand a lot within the presentation and just asking a lot of questions. But one of them being like, I can't remember the specific data, but it was like the Hispanic community and the doctor visits, and if you just look at that statistic, that they're less common to go and see a primary doctor. If you look at that and you see that, you would say, oh, well, you know, the Hispanic population doesn't necessarily care about health as much as, you know, non-Hispanic or another ethnicity, and that's not the case. I think a lot of, if you look deeper into those, is a lot of them don't have health insurance or don't qualify for health insurance. That's a disparity where I would say they value health, but it's just not accessible to them. Low-income families, one other one is mental health. A very, very common one that I'm very passionate about, that I'm also, you know, when the 6 months that I sat here, it's not just looking health in just the perspective of going to a primary doctor, health, well-being in general, and mental health being one of them, very, very important. And mental health, I mean, if you don't have income, it's really hard. If you don't have insurance, it's really hard to find a therapist or get treatment. Substance abuse. We, in McHenry County, we don't have a detox. We don't have any detox beds. We help individuals, and it's so sad to me. If you had money, you could. We have a lot of wonderful agencies that are supporting this. It's not that. It's just there's so many disparities that we're trying to overcome. And I don't, there's not a blame on anyone in particular or an agency or in this sector in particular. It's just they exist, and sometimes we don't realize. We look at that data like that where, well, they just don't care as much about or we confuse it with other things. It could be transportation, or it could be lack of education, and we can educate them, we can provide transportation for them, but there's a lot more disparities that exist, and one disparity causes another disparity, or other barriers causes just a greater disparity, and so that's just one example, but there's many.
That's a great example, thank you.
Go ahead.
I'm going to ask a question, although I think you answered it, but to be fair, I asked it of the previous applicant. What do you view, and maybe your answer is different, I shouldn't pre-qualify it that way. What do you view as the top 3 challenges in the county from a health perspective currently?
Mental health. We don't have psychiatry a whole lot. I think we lose a lot of physicians and a lot of service providers because the other counties pay more. It's that affordable housing doesn't exist. And so I have employees that are struggling that they struggle. They can't live on their own because of that, much less our clients. And so affordable housing, mental health, lack of physicians and service providers, and maybe they're living here but they're not working here because it's, you're getting paid, there's a huge disparity there, you're getting paid a lot more. And, what other one would I would say? Transportation. I see a lot of people leave our county because they can't buy a car, and we don't have a public transportation system that's as effective where you can get to work, and why you could get an Uber, but it's gonna cost you your paycheck, right? And so, yeah, I would say those things: mental health, transportation, and affordable housing.
As a member of the Board of Health, or I'll just say in general, I'll go to the mental health and the lack of providers in the county. What do you view as a potential solution, resolution? How do we tackle that?
Okay, I think mental health, it would be, right, you would think it would say, let's get more physicians, but I think we need to view mental health a little bit different. Like we need to do more prevention and intervention work that maybe wouldn't, there's individuals that might need psychiatry right away, but we need to catch our youth and adults and anyone early on before they're in crisis. I think doing prevention and intervention work would help with that, and they would also help with our other issue of not having enough psychiatrists, right? Hopefully getting them early on where we can do preventative work. Those, I think, like just intervention things simple things that you wouldn't think of, using the assets that we do have in our county. For instance, I think one of the amazing things that I love about McHenry County is our conservation district and all of the parks that we have, going and looking at mental health in that perspective. Let's go and let's do a walk somewhere, and let's do a community wellness walk. Let's do those things like that maybe are not going to cost our non-for-profits a ridiculous amount of money to hire or try and hire. We can get the funds to try and hire a psychiatrist, and we just can't find it, and we have waiting lists. And so how do we respond to those waiting lists, and how do we prevent crisis from happening, right? So I would say that getting our ER bills lower, so we're not having so many ER visits for mental health issues, and looking for detox beds, getting them early on in their addiction and things like that. So that would be one of the solutions that I think. And another one, I think this was really hard because where do we get money, right? But we need to start paying more, finding ways. I get it, as an ED, it's not easy. But we need to look at not duplicating any services and just thinking smarter. And I'm answering this as, an executive director. We need to think smarter of how we're using our money and try and find ways to keep our employees and give them what they deserve. And I know that's probably not where do you get the money? I don't know, right? But we need to do that. If not, we're going to continue losing great service providers and people that are living in our county, but that aren't serving our county and that don't get get the privilege that I get, that you get to serve the county that you live in. And so it's really sad to see people go for that. So I paying them more money, finding creative ways of doing that, collaborating. I think we need to work better in sectors. Our non-for-profits with our for-profits in our county, with the big non-for-profits with the smaller non-for-profits, and so working more together and collaborating. And I know we all have these concerns. And how do we share staff? How do we collaborate to respond to these needs in our county, but then also respond to the needs within our individual agencies and sectors?
I really appreciate your answer. I like the reference to conservation, because I've had a lot of thoughts about that myself recently, because I'm spending a lot of time walking around the conservation districts and the value that could provide in terms of prevention. In terms of, and I don't want to get too deep, but I'm interested in your thoughts on this. When it comes to, we keep hearing about the mental health crisis, and I think it's a combination of two things. One, access to care, but more primarily causation. In the youth specifically, and if you could put your finger on one or two things that are driving that, what are your thoughts on that?
I see a lot of anxiety in our youth, a lot. I think I saw it before the pandemic, but after the pandemic, it's just even worse. We struggle to get our youth to connect and interact with each other. And connection is so powerful, and we're losing that with our youth. If we can build that again, I think the anxiety and the depression will naturally reduce. So if we can overcome that, I think anxiety is the biggest thing, and I think it's the connection where technology is too available to us. And it's great, but it's with our youth, they don't know how to use it properly. And then also, I think with that, I think this is not just youth in general. We're in a society where everything is we want responses right away. And when we don't get responses right away, we shut down, and because we're used to a fast-paced world, and we want it now. And when we don't have that, we don't know how to respond. As adults, our youth don't. They just, they run into, they're very resilient, but they need a lot of people that will help them kind of, see that and see that they are very resilient, because they shut down and to something very simple. And I'm like, okay, let me remind you, and when you were 9, you lost your mom and you overcame that. You can't shut down because your dad took your phone, and so reminding them of how resilient they really are, and that those connections, and then feeling them part of a community is really, really important. I think everybody needs to feel like they belong, and that they're being heard, and that they're being seen. And I think naturally, I strongly believe that when people feel that, they want to do better. If other people think that they're better, they think, Kelly thinks that I'm a great person, I'm going to be a great, great person because Kelly thinks I'm a great person, right? I naturally believe that. I think we need to believe in people more, and people will be naturally better that way. They will. But we need to provide a community that believes in them and cares for them and is doing everything that we can to make this world and this place where they're living in a better place, I think naturally that will reduce the anxiety and the depression that exists in our youth. I think we live in a world where we're so centered in ourselves a lot of the times, and if we stop doing that a little bit more, I think we will connect more, and that will reduce that. That's like my example with youth. I think lack of connection and the fact that it's so fast-paced that they don't know how to respond to things that they're fully capable to respond to.
Thank you.
So, if we're talking about public health policy in relationship to that, how does the public health function from a policy perspective around what you just said? Because on the board, you're a policymaker, you're not a provider. And so what is the policy that the public health board can create to trigger actions around that?
I think getting to know how to be thinking as a service provider. You know, like a lot of the times people that are in policy are so, with all due respect, they're so disconnected from the reality of what it is. And you need to put yourself in those perspectives, and I think it's easier said than done. But you have to do that in order to create policies for those service providers, for those agencies, for those entities, for funding agencies that are, you know, it's all a trickle effect, and you got to know how it's connected. But you need to know that youth are suffering with mental health, and that it's real.
I sat with a group of young people, and they talked about school shootings. And there's no way that I can say, well, it's not going to happen here. I would never say that. I would never say that to them, because we don't know. And so as they struggle, and these are youth who are not identified with mental illness, but they do, the anxiety is palpable. And it ranges from kids as young as 7 who don't want to go to school. I don't want to go to school. And so to me, that's a policy issue when we talk about creating safe places, so that when I send I don't have an answer to that, you know, for young people who, and so I know what you're saying is accurate, because I've heard them say that to me.
Yeah, and Huntley, I just want to give you, I have a, just kind of like my niece. My cousin's daughter goes to Huntley School District. She, there was a tornado warning, and the alarm went on, and she said half her class was crying. There had been a lot of shootings that week, and obviously, you know, media, half the class was crying, and one of the girls was hyperventilating because of a tornado warning. I put myself in those kids, but I also put myself in the teacher. I don't know what, you know, how do you respond? It's so easy as policymakers for us to be like, yeah, well, it's not going to happen here, or it's not affecting. It is affecting, even though we haven't had a school shooting. It affects them every day. It affects them with a tornado warning. The more that we know that, and that we put ourselves in those children's shoes, in the parents of those children, or all of children, and teachers, principals, and then at the end, put yourself in the shoes of the policymaker. But I think first, it's the people that are in the front line, which is right now are the youth, right? Our youth, the parents, teachers.
That's a great way to look at it.
And then at the end, that's when I think you respond as a policymaker, because we can't say that. We can't say, well, it's anxiety. I've heard county residents say, well, they just gotta shake it off. They're just being rebellion, or they're just, and it's like, no, we are living at different times and we need to put ourselves in shoes that they're in now. And I encourage, it's so easy to say those things when you're not seeing that youth hyperventilating. Just tell them to calm down. Okay, you got half your class crying and it's a tornado warning and you got to do the drill, but how do you respond to those needs, right? And so I think that would be my answer. You put yourself in those shoes and then you respond to that. It doesn't sound like an answer, but I promise you that if you do that, I think you would better respond to those policies. And then when you're creating a policy or when something is decided, what are the effects of it? I think it's really important as a policymaker. Was it good? What were the benefits? Was it not? And what are the effects? Even if the policy is already made, how did this affect it? And then later, I mean, it's already made. We can't do anything now. But as a policymaker, you could express the effects of what the decision that was made, and how are we going to respond to them?
That's great, thank you very much.
Great, thank you. Okay, Mr. Hendricks, one last question?
You're the executive director for the Youth and Family Center in McHenry County. Does the Youth and Family Center in McHenry County receive or plan on applying for any funds from the Board of Health?
We do not receive currently any from the Board of Health. We receive some from the county.
But not from the
But
Board
not
of Health?
from the Board of Health, no, not directly, no.
Okay.
Oh, I apologize.
Sure.
One more thing.
Go ahead.
You seemed, you talked a lot about mental health in the county. And you're currently on the Board of Health. Is the Board of Health, is there any sort of cross collaboration currently between the Mental Health Board and the Board of Health?
I've seen cross collaboration with agencies that are funded through our wonderful mental health board. I don't think it's been specifically directly mental health services, but agencies that are supported through that. And again, this idea of kind of prevention and a different way of viewing treatment for mental health or care for mental health, not specifically, therapists and psychiatry directly, but collaboration with agencies that are trying to support that.
And about how much, and I'm just unaware, and if you don't know, that's fine too, but about how much of the Board of Health annual budget goes to mental health currently versus other care services?
I do not
You don't
know
know?
that. No, I should, right, as a, sat on 6 months, I was learning a whole lot.
No, I understand this.
Yeah, I don't know that, but I'm also, as a community leader, learning a lot of what other county funds go specifically to mental health services, and
Well, can you give me an example of that then?
yeah, the county budget going into the mental health,
The levy,
the levy with the mental health board.
the mental health levy.
What? Sorry, maybe I just missed it. Can you elaborate a little
Yeah,
bit?
the
about that?
county gives the levy to the mental health
Right.
board.
Yep.
Right, and so I've been learning more about that and the effects of that and how much, right now the mental health board just asked for a huge increase on that. How long it had been for us, the mental health board not getting an increase. And I've been learning a lot more of that process of it. I'm learning of how that's connected to the Board of Health and whatnot. But I wouldn't be able to tell you specifically the Board of Health and how it's connected to that. It's all super confusing on how county funds work. I was super proud when I got loan. Because, I was super proud when I was like, I feel like I got the grips of non-for-profit finance, and then I get to the county and I'm like, whoa. But I've been learning a lot more of how it, it's connected and how it's affected. And again, what we could do as constituents to kind of advocate for mental health services and how our county could support more of mental health services.
Does the Board of Health provide mental health services separate from the mental health board? The Board of Health does not currently? Okay. And then, because I think, and again, I could be wrong, it was just quick research. I think as far as the mental health board funding is concerned, irregardless of their new, I think, budget request, I looked, I think we spend double more, or the county spends twice or allocates twice as much funds as the next highest county to the mental health board. I know that's not related to the position you're applying for, obviously, but I was just wondering if, I guess, there's either economies of scale or efficiencies that can be made if the Board of Health is providing mental health services while also we have this separate mental health board.
Oh, that's interesting, dude. Like, I would love to look into that some more. Like, so we're spending, as a county, it's
So
almost double?
So I'm not sure what, and again, not every county has a mental health board, but my understanding is the funds that we provide to the mental health board is approximately double the next highest county, or at a minimum, the next highest, I guess, population representative county. Again, quick research done. But anyway, I was just wondering if, in addition to that money being spent, if the Board of Health is also allocating funds towards that issue or not.
The only thing that I've seen with the Board of Health maybe doing, they do Narcan training.
Okay.
But they're not the lead on that. Those are many not-for-profits in our county.
Right.
The county has now offered Narcan training, but not that I'm aware of. I don't think our nurses, we have a specific nurse directly with mental health services. Again, I think it's collaboration with the not-for-profits that are doing that work. One thing I will add to that in comparison of other counties, McHenry County is very hard to get specific grants because we're known as a high income county. And there's a lot of grants that when we're in competition with our other counties, we're like the least one, like for state and federal grants a lot of times, because if you look at us,
we're in the lowest priority tier.
Yeah, if you look at us through the outside lens, they're like, oh, that county is doing wonderful, right? But we also have had our governor visit us for substance abuse and our issue with opioids. So it's interesting to see how that works. But I think the support the fact that we are one of the fewer counties that has a mental health board, but we also have a lot of agencies doing great work in collaboration. I think that also, from what I've heard from other people coming into our county, they're like, your collaboration is just phenomenal. But, because we're not all isolated and working on our own, we have a network of people that we're tackling these mental health concerns together. And so I think that we naturally, collaborate more than other counties who are all on their own with these problems. And I think there's more duplication of services in other counties. The one that I'm maybe more familiar with is Lake County. There's so many duplication of services in Lake County.
Okay.
Could be because that their needs are bigger, but also they're not as connected. Agencies are not as connected as I see here in McHenry County, and I think that the mental health board has a lot to do with that.
This is a good discussion, but just to be clear, the health department doesn't provide mental health services.
Yeah.
The Board of Health.
Excuse me.
Yeah.
Well, same thing, health department, mental
Yeah.
health.
Thank you for saying that.
Okay.
It sounds like a great conversation for another committee. I'm wondering if there's anything more related to.
Yeah, just one last question, and I'm sorry, I'm asking more questions of you because you currently are on the Board of Health. You mentioned Narcan training. what's the, either in terms of the budget or just efforts of the board, what's the allocation of resources towards that? Is it half of the focus going towards
No.
drug, alcohol, opioid? No. If you had to just rough ballpark estimate, I won't hold you to it.
I
about-
wouldn't even be able to tell you.
Okay.
I know that they have an outreach person. That's not her whole focus. She's not a Narcan outreach person, right?
No, I'm not-
They have it available, so I wouldn't be able to tell you specifically because her role is not just that.
Just to be clear, not just Narcan, but just opioid, drug, alcohol,
I don't think-
prevention or treatment.
I don't think they have a specific position. Wow, I can't even say that word now. Position regarding that in general. So I don't even think the percentages, I couldn't even be able to tell you that because the person who does those, that's not her only role.
Right.
Like substance abuse is not her only role. So she probably is collaborating with our non-for-profits to help that support.
Do you know how roughly, again, just rough estimates if you're wrong, not gonna hold you to it. Do you know roughly how much of the budget of the the Board of Health's budget goes
No.
to those issues?
No,
Okay.
all I know is that we did have a county, we had one of their people train us on Narcan. And she said, if you guys need Narcan, it's available at the building, and that's all I know, so.
Okay, all right, thank you very much, I appreciate it.
Thank you for answering.
It's more of an information
Yeah.
session than
Yeah.
an interview.
Many questions, and thank you for joining us
Of
today. We
course.
certainly appreciate your continued interest. I'm not sure if we'll be deliberating shortly or not. We have 2 positions open, but if you'd like to stick with us, otherwise we will be in touch.
Okay, all right, sounds great, thank you.
Thank you.
Thank you.
Thank you, Sarah.
So, I know we lost.
Yeah, Ms. Hernandez was on there at
Yes.
9:30. Unfortunately, she only had 15 minutes before her next meeting. She did email me and said that she could not wait any longer, and she withdraws her application because of that. She didn't withdraw her application, but she could not interview.
So is she still interested in, is she still interested?
I did encourage her to apply again if there was another opening.
Oh, but,
She-
so for now, she has withdrawn her
Because I was
application.
kind of wondering if she was.
She did not formally say I
Tabled,
withdraw, but she had to go back to work. She said
Sure.
she could not wait online any longer. She only had 15 minutes until her next appointment, so.
We only got 2 of the 4. Can we interview the next 2 next month and then make a decision?
Or
Or is that too?
is Mr. Kostecki,
He never responded to my
He never responded.
voicemail or email, no.
and was he the individual that said he had miscalendared the interview, or was it?
No, I wrote to him.
Okay,
I left him a voicemail and let him know that we were here for his interview today, and if he made a mistake, if he would like to join WebEx, to give me a call or respond to my email, and I would send him a link right away, and then I sent him a follow-up email, letting him know that I sent him a voicemail and that we were waiting, and if he had forgotten, I could send him a WebEx, and that did go to a work email, but I haven't received anything back from him.
I would be interested in waiting to interview her.
the term,
The
Well,
other
honestly,
applicant,
you know,
because we only
yeah,
have 2.
The term begins the end of the month. I know, these will still have to go before Chairman Bueller, but
that was my
Commission
thought
seat
as
is still
well.
open.
I think we ought to move forward with.
The
Can I make a
term
motion?
expires in 30 days.
Just make it.
Can I make a motion?
Yeah.
I'd like to make a motion to, for the names of Guadalupe Ortiz and Sarah Clark to the County Board Chairman as recommendations to the Board of Health for the term to begin June 30th, 2023 and expire June 30th, 2026.
I'll second that.
Mr. Hendricks seconds. All right, all in
Hendricks,
Yes.
Ness,
Yes.
Shorten,
Yes.
Van Hoff,
Yes.
Wagner,
Yes.
Von Bergen.
Yes. Okay. Thank you, everyone, for your patience as we jump around here. So we are back to reports. I think we got everything up there. So, Hans, thank you for your patience and hanging out for the discussion on Yes in My Backyard.
Yes, so a lot of the times you hear the term YIMBY, not in my backyard, so this is sort of the opposite. In federal fiscal year 2022, Congress approved $85 million nationally for competitive grant applications, for reviewing ordinances, planning for sort of thinking of like infill, accessory dwelling units, those types of things, transit corridors. So this initiative has not been put out yet for consideration, but we're coming in advance to our standing group to discuss whether or not it would be acceptable to submit an application for that. The purpose of it would be to identify where we have gaps, where we may be able to focus again on infill or municipally owned land. Repurposing other units. Think of malls, for a good example, like everybody shopping on Amazon these days, and maybe not going to those shopping malls anymore. So revitalizing it with housing. The initiative obviously would be more of a planning tool to then inform public policy based on what that study determines. What I would also add in here is that a regional planning group can also make this application. So if that were to be the case, we would obviously tack onto that and maybe be part of their efforts and whatnot. So that could be R1 or that could be CMAP, one of those two organizations. So this is just a preemptive measure to discuss this with the group prior to the funding notice even coming out. It's definitely delayed. They had intended on having the funding out the door by September 30th this year, and they don't even have the application or any materials out yet. So this is us just trying to plan in advance, and since we have a workforce housing work group, we feel that this would be something good to include with that.
Yeah, I've already had 2 calls, people confused. Is that your group? I'm like, no, I had to kind of track it down through Adam Monday because I didn't know. And then after I talked to him, so is this something that you would do in collaboration with the workforce work group?
It would be a good thing to do in collaboration with the work group, but also to definitely work with the municipalities, and so COG would be.
So here's what I don't want to create, is I don't want to create confusion or redundancy when we do this, because I do think that has been part of the challenge in the past. People don't understand who's doing what where, and so if we could be aligned, at least in a way that the work gets integrated in the work that the work group is going, I think it would be more efficient than having 2 separate paths, 2 different groups doing the same thing. That's only my concern.
I think often with these sort of grant applications, they're already looking for an established work group, and so that would be.
Are you saying our work group could get some funding?
I'm saying I think that's a possibility.
Then I'm very interested. To help with the planning and
implementation, et
Oh.
cetera. So, so a lot of times what you see, I'll throw another example of something we're not applying for, a youth demonstration housing project, for example. That would be something where you'd want a youth-informed group involved. So that would need to be something either established in the process or already established when you apply for your application. So since we are at that point where we have something already established, it would make sense to utilize that work group that's already in existence.
Scott, does that make sense? Thanks.
Not sure when it's coming out, but this is just us being prepared.
I think we should look at everything.
I agree. So at this point, you're just kind of telling us about
Yes,
the program that could come out at some point.
exactly.
And that,
exactly.
yeah, no, I think that's a great idea to collaborate, you know, at least get some information about the need, specific needs.
And definitely looking at when the funding notice does come out, what's offered. And so that would be the time maybe to bring it to the group's attention, and whether it's an appropriate grant for us to apply for, or whether it's appropriate for us to participate in something more regionally oriented. I think we need to see what that says, and that's something probably the people at HUD have sitting on their desk right now as a project to do, and you know, we're looking forward to when that comes out.
Great, that'd be great.
Great. Other questions?
Thank you.
Thanks, Hans.
Thank you. Take care, everybody.
Thank you. Okay. Mr. Austin.
Super quick, just wanted to, as some of you know, the Finance Committee, when they met 3 weeks ago, they asked that the standing committees and offices that present their budgets beginning next month, kind of do it in a leaner fashion, and not so much background on what we do, but more focus on the numbers and how the numbers are changing from fiscal 23 to proposed fiscal 24. That's due in part because we had a major changeover in the board. We all were introduced to our offices and departments in the first quarter of this year, and everybody did kind of an overview. So it's not Finance Committee's role to tell you what your committee wants to hear, but I have had this discussion with Law and Government and Transportation Committee this week, and they both kind of echoed Finance Committee's position that just keep it to the numbers and a little bit less on who we are and what we do, but more on just the fiscal portion. Is that consistent with what you'd like, or would you like a little?
I think so. I mean, we've had presentations from, quite a few already. And so, we know how many, we know what they do. And I think we need to focus on the numbers more importantly. So I certainly appreciate
your department heads and elected officials know this discussion is happening. We've had this discussion with them at the department head meeting earlier this month, so they'll be ready. We're starting our budget reviews this afternoon. Risk management budget is the first one to go, so Carrie and I are getting ready. Thank you.
Great.
May or may not be a whiteboard.
No.
It will be a model, though, I'll tell you that.
I think we should get him a little whiteboard for Christmas.
Okay. Have we missed anything above? I don't believe so.
Well, I'm standing and you don't have anything to talk about. I will mention that. At 11 this morning, Leonetta and Melissa and I are meeting with Jason Sturworth. Jason's a former county employee who ran our specialty courts unit. He's now working for the City of McHenry Police Department. Jason is the chair of the Substance Abuse Coalition in the county. That's the coalition that Lori Crane ran for 9.5 years, and the grant funding for that program is running down now at the end of September, and we have no executive director. But the need continues, so we're going to begin that discussion about what does next look like, and what does it look like, who's staffing it, who's volunteering it, what are we paying for, what services need funding, what services have funding. So just beginning that discussion. So obviously this will be something we talk about more with you guys in the coming months.
Well, and I think something that was sort of emerged in Eric's questioning is there is there money from health department that funds mental health services?
No, there is not.
No, I know, but I'm just saying, like, is there a perception that some of these services are layer funding in other places. And I think we have to be clear about who's doing what and who's getting paid to do what, and that would be helpful. We're adjourning, Pam.
We did have a.
I'm on the record now.
Oh, that's right, you got your tooth pulled.
Chewing through 10 days.
Oh, my goodness.
You know, we can get you more information on the topic of Narcan. That has been completely grant funded, and it's going to the police departments largely. But again, those dollars are finite, and there does seem to be a sense that somewhere along the line, somebody else is going to have to pick up that tab beyond
Okay.
state and federal government.
Hank, is that still gonna be under the ROE?
No,
What department will that position be under?
that's exactly what we need to talk about.
Thanks
Does it
for-
exist? I mean, we know that there's work that's being done there that needs to be done, but do you even need a coalition? What was the coalition? I mean, it was yeah.
Okay, well, I take that as a future topic
Yeah.
then. Okay. All right, I don't see any need for executive session, so.
I'll make a motion to adjourn.
I second, you came just in time.
All in favor?